Hi, my name is Rebecca Hanlin,
And my name is Margrethe Holm Andersen.
and we're the authors of this latest Globelics Thematic Review on health system strengthening. So, the Globelics Thematic Review is a regular review that is conducted by the Globelics Network to get people talking about neglected research areas, but also to showcase the work of Globelics scholars. This Globelics Thematic Review is focused on health system strengthening. We chose the concept and the idea of health system strengthening as the subject area for this Globelics Thematic Review because it is a subject that is essential for the development of every society. Good health is essential for strong economic and social development. At the same time, there is a huge amount of discussion about the place of innovation in the healthcare sector around the world, not just in developed countries. Similarly, many Globelics scholars talk about and research issues of health innovation. Unfortunately, to date, those two sets of communities, the health policy community and the innovation scholar community, has rarely interacted. And so this report is an attempt at bringing those two fields of research and study and practice together. So what we do in this report is we review the different literatures from these different fields, and we look at the similarities and differences between the ideas that are outlined in this report. We focus very heavily on a concept of social innovation and the importance of getting the right mix of people, resources, and ways of working to ensure that health systems are strengthened in the appropriate way, and not just on the right physical, technological innovations. So the right medicines, drugs, and medical devices. At the same time, we present an analytical framework which we think is a way of overcoming the silos between the two fields and providing a way of looking at how social innovation and physical technologies can really improve on health system strengthening together. So this analytical framework, which we call the 4 Fs, we investigated looking at case studies of India and Kenya, and show how we think it can be useful in overcoming these gaps.
So in the report, I think policymakers might find inspiration for different ways of acting on some of the insights that we provide in the report. In particular, we emphasize 3 or 4 different things that we think policymakers could pick up on. The first one is the very big need that there is for more support to interdisciplinary and multidisciplinary support in the field. So trying to connect more the different types of insights and look more into what's really has to happen in terms of connecting the fields of innovation and health. And as was stressed earlier, it's not just about the technological innovation, it's also about social innovation and having more information on that. The second thing that policymakers might want to use the report for is basically to have a better frame for a holistic approach to analyzing loops, gap holes, and areas for interaction or intervention in national systems of health or health systems, so that these actually can be strengthened. And the 4F lens that we have provided in the report provides a framework for doing that. So we hope that policymakers will also use it for analyzing national systems. It will take quite some effort, and I think it will have to be a collective effort by policymakers in connection with researchers of national systems of health, and with people who have an insight into how innovation systems thinking works and could actually work to help promote better health outcomes in different types of contexts and settings. And the last point I want to emphasize is the need for breaking down the silos. We've talked about that in 2 different ways, I think, in the report. So we talk about it first in terms of breaking down silos between ways of thinking and academic communities. But we also plea that it's important to break down the silos between academicians, politicians or policymakers in a broader sense, and then the practitioners. And we think that there are lots of good examples of how this can be done, but these need to really be promoted in different contexts, different countries, and they need support from international donors, not least, because these things do not happen by themselves. So we hope you will use the report and enjoy reading.